Alhamdulillah, Alhamdulillahi Rabbil Alameen, wassalatu wassalamu ala Rasulihil Ameen. Assalamu alaikum. So the shoe is on the other foot now, so I will keep an eye on the clock. This is the obligatory disclaimer slide for anyone who works in industry or actually works or has other consulting obligations. This is to make clear that my employer, Astellas Pharma, had nothing to do with my presentation. They care very little for the work that I do here, but they did allow me to come. As an introduction, American Muslim views on healing have been studied through community-based participatory research, and Dr. Padella, who's our host this weekend, has done some of the sentinel work in this area. And in quick summary, what it found was that participants often share a God-centric view of healing, and that healing is accessed through supplication, through Quranic recitation. These are considered direct means, but it's also accessed through human agents or indirect means. And Dr. Patel's work has provided a nice classification scheme from the perspective of a Muslim who is seeking healing. We heard from Dr. Daniel Solmesi at our session last night, and Dr. Solmesi back in 2002 had proposed expanding the biopsychosocial model of patient care to a biopsychosocial spiritual model of care. And this was based on the supposition that holistic care requires an understanding that persons are beings in relationship with questions of transcendence. And this brings us to the issue of ontology. Now, I would be much more comfortable talking about oncology rather than ontology. So I am by no means an expert in this area, but the purpose of this abstract is to demonstrate some of the work of the working group that Dr. Padella introduced at the beginning, and how practitioners in certain areas came together with scholars and academicians to really understand ontology in terms of how it provides a bridge between these different worlds. So ontology, sort of the Wikipedia definition, is a branch of metaphysics concerned with the nature and relations of being, and it can provide a bridge to facilitate understanding causes and means of healing. And that's the intent with which we're going to talk about it today. So three main purposes. The first is to describe an ontological schema derived from Sunni Islamic theological and metaphysical understandings. Now, it needs to be clear that there are many understandings within this area, and what we're proposing today is simply a schema that allowed us to have this conversation about really what are means of healing. And to utilize that schema to explain those causes and means, and then to give you a case example of how that ontological schema-based representation could be useful in understanding the means of healing. And we're going to walk through that example at the end. This paper emerges from a multidisciplinary working group project that was convened by the Institute of Islamic Medicine here at the University of Chicago and Darul Qasim, which is an institute of higher Islamic studies, which is based in the suburbs here in Chicago. The title of this group was Scientific Discoveries and Theological Realities, Exploring the Intersection of Islam and the Human Sciences, and it was funded by the John Templeton Foundation, and certainly a personal thanks to the Templeton Foundation for facilitating our ability to create this work. Dr. Qasim has already introduced you to several of the working group members who are present. Many of them are present today. And an earlier version of this abstract, in its earlier formulation, was presented at the Conference on Medicine and Religion in Massachusetts last spring. So let's start off by talking about the ontological schema that we'd like to try to use today. So there, as we described, there's numerous formulations and overlapping terminologies that are used to describe Islamic ontological frameworks. And what I'm going to share with you is an ontological schema that was derived from the works of Ibn Arabi and Shah Waliullah, and that has been adopted by Deobandi scholars. But I want to, at the outset, say that this is being presented from the perspective of a human being that is living life in this world, in this dunya, and that person who then an illness or a reason for seeking healing comes upon them. So from that perspective, from that limited perspective that we have, let's say, if illness was to come to us as an individual, this schema may give us some insight into how we would understand these layers of existence. So what might that look like? So we would describe one layer or one realm of existence known as the lahut, which is the realm of existence in which there is absolute and internal divine existence alone. We make this clear distinction. This is nothing new to us as Muslims. The idea that the Creator has a level of existence in which no creation actually participates. We have the next layer of creation known as the malakut. And this is represented through what we would commonly think of as the worlds of spirits, the arwah, where aru can relate, and other celestial beings like the angels. There is a realm of existence known as the mithal, which is also a created realm, and this can be described as a world of non-physical forms or similitudes. And this is the realm that we may be able to access through dreams. And we've had discussion already today on what happens when a person is sleeping. And the notion that we're in real dreams, that this world does have an existence. And it may be something that is important to think about when we're thinking about means of healing and curing. And then the ajsam, certainly the world of corporeal bodies that is accessible, the world of empirical knowledge, the world that most of us live 99.9% of our time in, and certainly thinking about, is how do we understand the ajsam as a bona fide realm of existence. I don't think any Muslim would deny that that realm of existence exists. The idea is that all of these realms do exist. And how do we account for that when we think about what might be useful as a means of healing? So how would one think about this? There's several perspectives. One would be a theological perspective, and that is that Allah subhanahu wa ta'ala is the one who heals. And we all are familiar with this verse from Surah Al-Shu'ara, in which that Ibrahim alayhi says, when I, Ibrahim, become sick, then he, Allah, heals me. Okay, this is a theological reality for a Muslim, that when one becomes sick, that Allah is the one who heals him. From a patient perspective then, if we believe in this theological reality, then the primary concern for a patient, for a person who has an illness, would be how do I attract divine attention to heal my illness? What do I do to actually attract that attention? If I realize that the healing will come from the divine, how do I attract that attention? From an ontological perspective, if we look back at this schema, we appreciate that healing will come from the lahut, that healing is created by the absolute and eternal divine existence, but that healing will manifest in the ajsam. Okay? So how does this help us understand potential means of healing? We heard already a question about the concept of tawakkul. And one given definition for tawakkul is to completely rely on and trust Allah without panicking when there are no conventional means available. And this notion of tawakkul could be mapped to, within our ontology, the idea that healing comes from the lahut. So without any physical means of healing, the notion that Allah subhanahu wa ta'ala could choose to heal someone, this has to be within the realm of possibilities. Now again, this is not to preclude that we would seek other means of healing in concert with this. But it is important to acknowledge that that is a critical point that needs to be acknowledged. That this is something that needs to be there in the mind of a person. And sometimes it may be taken for granted. We may think that that's the case. But as we go through, hopefully, the case example, I'll kind of raise points, hopefully, that will question whether this is actually the case or not. We have the concept of sabr, or patience. So this is, again, the idea that when something comes upon us, that we receive that with patience. Now, again, that may not be seen as a bona fide means of healing. But we may have examples where patience in and of itself, because of the advice of the Prophet ﷺ, may actually induce healing. And we have to acknowledge that that may be a possibility. We have what many of us practice, and hopefully we do for each other, and that is to supplicate to Allah for a cure, to make dua. That the human being actually performs an action, and we know that dua is also tied to the realm of the malakut in terms of the delivery of the dua. And so again, the ontology helps us maybe understand in a different way how du'as work. We have the concept of giving sadaqah. This is also very common advice, that when someone becomes ill, that we give charity on their behalf, or they give charity by themselves. Now again, if we're thinking in simply an empirical sense, why would donating something help you get better? Doesn't really make sense. Taking a pill, that makes sense. But why would donating to somebody to do some charity, why would that make sense? Well, this ontology would help us understand that the sadaqah itself it affects a certain realm of existence. It has a motion. It moves things in a certain way that may attract that divine attention. Visitation by others. Something, again, that we are encouraged to do as Muslims. There's tremendous reward given to us for visiting the sick. This is something that when we're doing our rounds in the hospital or we're working in clinic, this is something that should hopefully keep us stimulated to do what we're doing. that we are given the privilege of working in a field where we are with patients all the time. We're visiting the sick all the time. But when we read about this and we learn about this from a different realm, or let's say through a traditional Islamic perspective, we also appreciate that when you visit someone who is sick, the Prophet says that 70,000 angels make dua for that person. Okay? So this also is affected and has an effect in the realm of the malakut. There may be a potential means of healing that is given to somebody, or preventive actions that may come to somebody through a dream. Now again, in the realm of dreams, in the realm of the mithal, there are practitioners, there are formal ways in which dreams are interpreted. But the idea that that's a bona fide source of healing, or in many cases a source of preventing something that may become harmful to someone, we should also recognize that as a potential means. And then we come to the things that we're all very familiar with. Medications, surgery. Of course, I'm going to put medications first, right, being from the pharmaceutical industry. It was very interesting, the open-mindedness of everyone to someone from the pharmaceutical industry, but we'll let that be. And then we have another realm that often comes into play, and that is the idea of incantations, amulets that are from, again, maybe not a realm that many of us as physicians are familiar with, but traditional healers that may actually give prescriptions in terms of incantations and amulets. And again, what is the impact of that? What is the basis for that in terms of the ontology? And how might that be effective both through the realm of the malakut, and again, how does that attract divine attention? So again, as Muslims, we will often think of prophets, alayhim assalam, as role models, and also often will give some proof and some evidence to support these concepts. So if we think about the circumstance of Ayyub al-Asam, we would raise him as an example of someone who had perfect tawakkul. Right? So again, the circumstance of Ayyub al-Asam's illness, the entire story that, again, everyone is very familiar with, he limited himself to this concept of perfect trust in Allah. And what we have to acknowledge at the end of the day is that he was healed. Now, again, not necessarily to limit this or to say this is a prescription for all of us to follow that example alone, but to acknowledge the idea that tawakkul in and of itself, through this example, we have evidence that that can lead to healing. Open that door. My suggestion is simply leave that door open. Don't shut that door so quickly. Again, I think many times we shut that door in response to the need to justify other action. But tawakkul in and of itself has an impact, and it provides a key foundation for the Muslim to handle the seeking of means of healing. We have, from the other perspective, we have Isa Asam, who was the perfect healer. So if we're thinking about as a physician who could be our role model there, we must appreciate that Isa Asam healed other human beings without a physical means. All right? Again, the stories that we all know, but I think as practitioners of medicine, we have to pause to realize that he was given, by Allah's leave, the ability to do this. Now, we probably don't have that leave. I'm not suggesting that a patient comes to you and their sight is going away, right, that you try to do what Isa Asam did. But I am suggesting that as Muslims, we have to have this within our consciousness. We have to raise the level that this is a reality and to give it its credence. So let's take a case example of a patient with chronic lymphocytic leukemia. So chronic lymphocytic leukemia is an indolent, very slow-growing cancer in which too many immature lymphocytes, white blood cells, are found mostly in the bone and bone marrow. So let's say that one of our patients comes to us, or Allah forbid that maybe to us ourselves, we're given this diagnosis. So the question comes, what means of healing could one use based on our ontological scheme? So our first inclination almost always will be in the Absan. The first question will be, how can you treat this? Are there medicines that can do this? Are there procedures? Do you do a bone marrow transplant? Are there medicines out there? This is what I do for a living, is developing these medicines. Okay, so my mind will always go to this first. We may also ask from the mithal, could this be, or could there have been, somebody within that person's circle who had a dream about this, or had some other insight into what might be beneficial to this person? Again, this is never a question that we ask. It's not part of our routine history and physical, right? Tell me about your family history, who had a dream about this, right? It's not the kind of thing that we typically ask. And I'm not suggesting that you add that into your repertoire, but at least conceive that that's a possibility. From the perspective of the malakut, could there be things that this person could do? Is there charity that could be given on that person's behalf? Are there du'as that would be particularly helpful for that person? Again, not in exclusion of the others. The issue here is not to exclude any of them, but to holistically think about this as a package. And then from the lahut itself, is there something that this human being can do in terms of their own tawakkul? We as practitioners will observe a patient's reaction when they receive bad news. And from that reaction, we often will get tremendous insight into the state of that particular person's tawakkul. We have to be sensitive to this, and we have to appreciate that if that person looks very agitated, very nervous, very worried, we have to account for that. If, on the other hand, this person gets this kind of diagnosis and is very calm, is very relaxed, our ability to help that person often is improved. And many times what we underappreciate is the role of that person's tawakkul, even in their own ability to handle the treatment. So we come to the role model of role models, and that would be Prophet Muhammad sallallahu alaihi wasallam. So the Prophet ﷺ had all of these examples, and all of these rolled up together, and he gave us advices on all of these things. So the notion of tawakkul being a real concept, a foundation of how a believer approaches seeking healing, he advised patients to be patient. We even use the terminology, and we don't often think about it, right? We call a person who's ill patient. Why do we use that word? We don't say sick person, we don't say ill person, we say a patient. Inherently in that concept is the notion that a human being, when they're given this, that they inherently have to have some patience. Now, how they conceptualize it, how they understand it, may vary, and certainly Islam has a lot to say about what patience actually is, and how it's received and how it's acted upon. But this idea of being patient is a part of that armamentarium. Seeking divine attention for their cure, their dua, their supplication, their sadaqah, again, things that we should consider that these may have a real impact on this patient's healing. Part of the reality is, do we as physicians, Muslim physicians, actually believe this? Do we actually believe that if someone makes dua that it's going to make a difference? That's a challenge not for this scheme, that's a challenge for us individually. Do we actually buy that this is real or not? And that's something that we all grapple with ourselves. And then we have this idea of seeking human assistance to care, or for cure, for healing. The idea of incantations and amulets, right? In the medical profession, we call it witch doctoring, right? We like to put this aside. We like to say, there's no empirical evidence for this. Are you kidding me, right? That you're going to write about this, you're going to write something, and the person's going to get healed. Well, the reality is, maybe we should pause a little bit and not exclude it so quickly. And also think about, even from a medical perspective, what's the harm in that? Assuming that the person is using that in concert with these other things that we do think would be beneficial to them. How do we approach that? How do we open our minds to that possibility? And the reality is, most of us have had very little experience in seeing this done well. Just like we will make fun of our fellow practitioners for not practicing that well, we'll do it in snide ways. It's also important to see that there is a world of people who practice this quite well and do tremendous benefit for people, but most of us have never had exposure to that, and not to exclude that possibility. The idea of counseling, the idea of meditation, the idea of medications and surgery, these are all things that are very common to us. I'm not spending a lot of time talking about medication and surgery because that's sort of a given that we would encourage that. So ontological frameworks can support an understanding of causes and means of healing, and patient and provider understandings of alternative oncological frameworks will likely facilitate enhanced communications regarding the means of healing and a distinction between relying versus seeking means of healing. And part of the challenge for us is we are bringing these concepts into an English language that often is distinguishing between active and passive. We're trying to defend ideas that sometimes don't have a place in the English literature or in the English language always, that this actually has a bona fide way to affect things. So how can something that you do passively actually have an effect? Right? This is something that we as scientists have a really difficult time getting over. But as Muslims, the idea that someone has tawakkul and receives an illness and manages that illness and relies on Allah subhanahu wa ta'ala, that is a type of activity. It may be hidden. It may not be something that we measure all the time, but it may be very present and it may be extremely powerful. So again, going back to my example, you can imagine, and any of you that have taken care of a patient with CLL, know that you reach a point in that disease where you really can't do much else. That's why the C is there. You can't cure it. And so you've given this person drugs and you've given this person so many things, and you will reach a point in the treatment of that patient where you know that you really can't do much more. When you reach that point, what is left for that person to do? What is left for that person to hold on to? And what I've observed is patients who had tawakkul, even at the outset of their initial diagnosis, they handle that transition very gracefully. And they make that decision and that transition, that acceptance that death is a reality. And this whole picture of much of what we're talking about over the next day is based on that foundation. I've also seen patients where that's not the case. And it creates tremendous turmoil when medicine has reached the end of what it can do. So again, these concepts I think are particularly powerful, and really the intent here is to open up your minds about how to think about this and whether there are ways to bring this forward.
So the only comment I guess I want to make is that when you say that when somebody suffered from illness and then you imply all these means that suffering or illness is also from God. So we have to take that in the context. That is not coming beyond God, but it is also coming from God. Mm-hmm. The other point is that when we rely on sort of non-physical or non-common means like prayer, etc., and say that God is the facilitator of that, in the same way, with the physical means are also facilitated by God. Because as we know, some medications work and others don't, in the same person. So when you say when you give a medication, the fact that it is going to work or not is also linked with God's sort of will or ability for that medication to cure. So all those methods are directly linked with Tawheed or Tawheed Afali, that they are in direct relation. So they are not sort of separate or cut from the God. We have to take in that context. And I think I have a little different opinion about tawakkul. Tawakkul, the way I see is tawakkul is that you do the action and then rely on God for result. It does not mean you do not do the action. You still do the action, but you rely on God for the result. That is how I see
Awesome smiling, because that's his view also.
Yeah, I mean, that's I think how I see the tawakkul, not necessarily that you leave your hand and say, I'm relying. No, I don't think that's the wrong understanding of tawakkul. That, I mean, I get just to be, so that's all I want to say. Thank you.
Excellent. So 3 questions, if I can take them one at a time. The first one is the idea that illness, suffering also comes from Allah subhanahu wa ta'ala. The answer to that is yes. It's very interesting because when we presented this at the conference on medicine and religion, many of our Christian colleagues, they had a big problem with this idea. And the reality for us is that's yes. The answer is yes. It's pretty simple. I don't think we have a hang-up about that. The second question was in terms of non-physical means versus physical means. And I think the point we're trying to make is that when we are discussing this in an academic sense, and we're trying to develop a schema upon which to convey this to a mainstream medical audience, this concept that the reason a Muslim believes a pill works is because it's Allah's will, that's helpful. But I think, and honestly, I don't know that adds that much to the mainstream discourse. I think what adds to the mainstream discourse is this concept that there are non-physical means that are just as genuine and may actually be just as effective. The fact that we haven't studied them or the fact that we can't measure them, it's from that perspective that I was sort of pushing those. So completely agree that is the case. But I think the other challenge that I would place on that is that in our time right now, do we think that as Muslims, the bigger challenge for us is to believe in the pill or to believe that the pill only works if Allah wants it to work? And I would posit the bigger challenge for us is to remember that the pill only works if Allah wants it to work. I really don't think that we have that much trouble taking the pill. Now, some of Asim's work implies a difference in that. But in your common conversations, even among physicians, there's very little concern from people about taking the pill. It's that, do you understand that your tawakkul is independent of that pill? And to appreciate that Allah subhanahu wa ta'ala can heal you without a pill. And that's really all that we're trying to say. The idea that tawakkul involves that you do first and then rely, I think Ayyub al-Assam's example would suggest the opposite. Okay? Because the question is that in and of itself a means to heal? Now again, what we're worried about, I think what I hear behind that comment is what we're worried about is if we say that, then a patient will use that as a reason not to take a pill. That's the concern. But I think for the purposes of this conference, what we should do is put aside the practical concern about that and just talk about it conceptually. conceptually, can tawakkul actually engender healing? Can Allah choose to heal somebody based on their reliance only on Allah? And on that level, I would suggest that there's evidence to suggest that that's the case. But again, it's an open discussion, and your opinion is probably in the majority.
So we have to separate context. So you'll see in our presentation tomorrow, just giving a sense about the way that jurists think about tawakkul and how that relates to seeking of healing in a juridical discourse. And what Ahsan is trying to present here is a theological sense of, can that be different, a tawakkul as non-action as opposed to as action from a theological perspective. I just want to, there's different layers of conversation that we need to decipher through when we talk about that. In any case, you're 2, 3.
Assalamu alaikum. Thank you so much. Starting from this point, I think it needs more elaboration and explanation about tawakkul and tawakkul. It's debatable, and unfortunately, it's still, even nowadays, there are some people have a problem to take the bill because they think the complete tawakkul, where you're not taking any action, even not seeking medical advice if you are sick, and just trust Allah, He will heal you. This is a lot.
Is that possible?
No, it's not, but it's available. The question is, this exists in our Islamic world?
Sure.
Maybe here, not in America, but in our Islamic world, it's
it exists here. I mean, Ahsan has documented it.
Yeah. So this is a problem. I think there's misunderstanding about that. You have a point about patient. You said completely rely on the trust on and trust Allah without panicking when there are no conventional means available.
That was given for tawakkul.
What?
For tawakkul.
Yeah, that's tawakkul. Sorry. Yeah. This is the same point. Like, I think I agree with him. Like, even if there is conventional mean available, you still have to do tawakkul, because there is a narration. One of the Sahaba, he came and they found some people in a mosque during after our Prophet ﷺ, he passed away, and he asked her, who are those people? They told him, those are al-mutawakkilun. He said, if they were true in their tawakkul, then they would have taken لو صدقوا في التوكل لأحسنوا العمل.
Sure.
That's it. So that's simple.
Sure. And again, to be clear, I'm not suggesting that tawakkul excludes the idea that you act. Okay. So that's not the point that I'm trying to make. I'm simply saying that if we think about the way that we think about these issues, and why I think this has gotten such an interesting response, is because there's a certain presumption. And I think we should acknowledge that. As medical practitioners, we want the pill to work. That's what we're trained to do. And the idea that somebody doesn't take that pill, at a certain level, at a professional level, becomes offensive. Now, I think what we have to be able to do is to step back from that. And I think that's what this working group forced us to do, was to step out of the medical realm for a few minutes and to ask the question in a broader perspective, and to say, as a Muslim concerned about their akhirah and the impact on that, and trying to see it through a theologian's lens or a different way, what is the impact of that? Now, the legal aspect of that, as Qasim said, there'll be a paper on that. But conceptually, not to acknowledge the idea that tawakkul in and of itself could lead to a human being's healing, I think is short-sighted. I think that's a mistake, and it doesn't preclude the idea that a human being would need to act.
I agree with the previous two respondents, and I think you're not really understanding what's being said about tawakkul, because you are creating this dichotomy between tawakkul means only relying on Allah and not taking the pill or other means, or you take those means. I think it is offensive when it's theologically offensive. As the hadith says, when a person says, I'm only going to rely on Allah and not take the asbab, not take the means that Allah subhanahu wa ta'ala has provided, there's a legitimate theological response to say, you don't understand tawakkul. That is not what tawakkul is. So the prophetic teaching is that tawakkul is taking the asbab. It is not saying, I'm going to sit here and money's going to drop from the tree or something like this. So I think there's a problem in the categorization. And I think it's also a misunderstanding of the story of Ayub. Because the story of Ayub is not about tawakkul, it's about qadr. And that qadr and sabr. qadr and sabr, which is that Ayub's companions are telling him, well, you must be sick because you did this or you did that or you didn't have enough faith. And his view is that, no, everything is from Allah. Everything is from Allah. I didn't have to do anything to suffer, right? Which is an acceptance of qadr, that good and evil, this is evil, that it comes from Allah. So it's this perfect understanding of one of the arkan, al-iman, which is to accept that. My final point is, and in a completely different area, is an epistemological problem and also professional ethics problem. One, the epistemological problem with dreams, which is that, I mean, as a person can have their own, the person who dreams knows what they dreamed. We can never know what was in someone else's mind, so it's a question of trust. And there's a problem of potential manipulation in this area, which is why people are very concerned about it. The same thing with traditional healers. Physicians and medical practitioners have very strict professional ethics. Traditional healers do not. They do not have oversight. Very often the healing is done in a private area with vulnerable people. This is why people have become very suspicious of them, because that area has been just ripe with abuse. And so if they are reintroduced, they need to have the same standards of oversight and accountability and professional ethics, and not crossing lines that other practitioners would have.
So the first one, tawakkul, I think the three questioners are asking the same question. And I acknowledge that is, you're very much entitled to that opinion. I think what I'm just trying to reflect is that when we're presenting this, I've never presented that these are exclusive means of healing. And that was never the implication, and that was never actually said. All I'm trying to say is that when we want to understand them, it is important that we're able to describe them and think about them independently. Now, the idea that someone can have tawakkul, that deserves its own attention. It doesn't preclude that person from taking a pill to cure them. It doesn't preclude them from those other means, because nowhere have we presented the idea that that should exclude you from being able to do that. Okay? So I just want to be clear, but I think for the purposes of describing that concept, I think sometimes that concept gets subsumed into action. And I think that's a disservice to the concept. Now, again, for the understanding of Ayub al-Sam's, I'm not a scholar. Certainly, I would allow your interpretation of that. I'm simply stating what we talked about in the working group from the scholars. This was their understanding. This is an understanding that they had, and it's not an outrageous understanding. It is also a possibility. I think at the end of the day, the question is, does everybody accept the supposition that Allah subhanahu wa ta'ala can heal without a physical means? And I think the clear answer to that is yes. Now, does that mean that we don't seek a physical means? That's a separate question. Okay, so all I'm trying to do is to raise the idea that based on our ontological understanding, that is a possibility, and allow that possibility to exist, and not out of response to the world we live in right now necessarily close that possibility. I think would be the best way to address that.
Said.
So,
as far as opinions go, I've kind of held the belief that this isn't a dichotomy, it's more of a simultaneous relationship, that tawakkul really includes, not only your belief in Allah subhanahu wa ta'ala's ability to cure in this case, but also the ability provided to you, the tools given to you as a physician or as a patient, the tools given to your physician to provide that cure as a means to that cure. So that was just one comment I had to kind of bounce off the other folks. The second question I have is, how do you then reconcile, and Asim's going to shake his head because he's heard me ask this in multiple settings, how do you reconcile the concept of tawakkul with patients who have this belief to the extent, and you touched on it a little bit, to the extent that you have reached the end of medical treatment, care is quote unquote futile at this point in time, and yet they are holding on to belief of a miracle at this point, solely based on their tawakkul, and in the absence of any other scientific interventions that you can offer them.
The question about how you approach a patient who holds on to hope is kind of what you're describing, and all of us have had these patients. That when that patient is very, very sick and there's nothing that medicine has to offer, and they hold on to hope that a cure may come. The question I would ask you is, what's the harm in that? That if from a patient's perspective, they have that hope, and what we're able to measure, our science is not able to see a cure, we have, and we do, have documented evidence of cases of people with tumors who we didn't think were going to get cured, and they get cured. And we don't have a great explanation for it. So the idea that that possibility exists, I think we should be open to. I don't think we should close that. And in most of my experiences, when a patient has that, now, what we should be able to do as medical professionals is to state to them very clearly, what do we have to offer that we think would be beneficial? And we can state clearly that what we have to offer is not beneficial in your circumstance. And we should be very clear about that. That doesn't preclude what a person believes or what a person feels, and it shouldn't. So the idea that that person could actually have that ability to have that hope, again, I don't think that that's ridiculous. Now, if that person is asking for something that as a medical professional, in your assessment, you say that this is not useful for this person, there is no justification medically to use that for this person, that's your judgment as a physician. And you're given that license. That's why you have a medical license. So maybe I'm not understanding the conflict that you're describing as well.
Right, so tawakkul is action, but tawakkul is inaction. Linguistically, tawakkul and tawakkul, there's a difference. Tawakkul is when you don't do your part, and tawakkul is when you do your part. So when you are putting tawakkul in Allah subhanahu wa ta'ala, that is an action, even though it seems like it's passive. But tawakkul, there's another term called tawakkul, which means no action, you're just, you're not doing your part, you're just totally relying on Allah subhanahu wa ta'ala.
I just wanted to comment because you said, what's the harm in that, right? There can be a lot of harm. And just the last year I've had two people, a young man whose family insists that they absolutely will do anything in life, 3 years on machines, his body decaying, waiting for that miracle. A little girl, same thing. The harm is tremendous. And I think the problem here is a confusion about what our goal is, right? So they're making the ultimate goal, the highest value cure from disease. The Prophet Muhammad died. The prophets all died, right? Like they died. To be cured of a disease is not the highest proof that your faith is the highest, or proof of ultimate tawakkul. So the problem is that the confusion here is that they're waiting for that miracle as evidence, or they're holding on to this, believing that there's this kind of value that they ascribe to waiting for that intervention, that's proof that their faith is higher. It's this higher tawakkul level. Whereas what we have to have is acceptance, faith in our qadr, in our destiny. And sometimes, our destiny is to die at some point. So there is that harmful state, and palliative care physicians, ICU physicians are facing this all the time, where Muslim families absolutely refuse to let go, to great harm to people, psychological harm, emotional harm, economic harm, all sorts of harms.
This is all presupposed on the idea that you accept that life and death are there, that they're realities, and in that circumstance, how this might work. So the idea that someone believes, the flip side of that is, we say this all the time in cancer care, that a big part of that person's healing is that they believe that they can be healed. So where and when you cut that off, I think that is an art. And you're right, palliative physicians, myself included, we deal with this on a regular basis. So I'm not acknowledging that issue. But I think for the purposes of what we're talking about here, I think this is a little bit different. I think what we're talking about here is in the structure of what we understand as Muslims, what we believe in as Muslims, right? Then from that construct, this idea of tawakkul actually helps very much at that point in time. It is the acknowledgement, and it's the reliance on Allah. And you will see patients, notwithstanding the examples you're given, you'll see the opposite. You will see many Muslim patients in particular who at that point will know to let go understand and appreciate that medicine doesn't have anything to give them, and their ability to do that actually impresses very much my colleagues in the palliative world. So again, I think that there's two sides to that coin. No doubt, it creates a problem.
Before the next question for Dr. Qasim, do you want to respond?
But what I'd like you to do for 2 minutes is go back a few slides. And so this is I think that we know you have to do work on tawakkul, but let's go back to the slide of your that one. So can you just give a sense, because I think we just started, we're only on the top, right? So would you mind working through why there's malakut and mithal and ajsam and these middle realms? What that means, are they passageways, or how's the schema working on these other levels? So I think then people in lunch can accost you on those methods as well, and then you can go home and sleep.
To understand the thinking behind this sort of a schema, and this is something that we're working on actively right now, is to work through this. What I wanted to give you a sense of from here is one of the challenges when we go out into the mainstream and try to discuss these potential means of healing. And we need to find a bridge to be able to talk about these means of healing, not just in terms of that they're genuine, but also how are they based on a deeper understanding of reality. And it's from that perspective that the framework on the slide before comes about and can be particularly helpful. So if we take the example of supplication to Allah for cure. Now one could argue that that starts in the ajsam, right? It's a physical act. So that's a part of the ontology, right? That the human being acts in the ajsam. The part that's not going to be, and again, people have studied prayer and spirituality and healing and so on. The part that may be a little bit different or a little bit nuanced or a little bit bringing something a little bit new to the table would be the concept of how do we as a Muslim understand dua with respect to the ontology. So the idea that it's related through the malakut, this understanding of angels, what is the role of the angels? The understanding of the human beings, ruh, right? One of the brothers mentioned that earlier. So the idea that the ruh has a place in the ontological scheme to relate to. These concepts are something that can help us discuss how do we as Muslims bring to the table the idea of dua. The idea of sadaqah, again, I spent a little bit of time talking about this. Inherently, it doesn't make logical sense, right? If you're presenting this at a scientific conference, why is anybody going to believe you that giving charity on someone's behalf is going to help them heal, right? Number one, you're going to diminish the money that they're going to pay into the system, right? So that's not helpful, right? They may not have as many resources to take care of themselves. There's all sorts of arguments that can be made as to why that's not beneficial. How do we explain that from an ontological perspective? That was one of the tasks that the working group was taking up. There are different ways that you could do this. You could do this at a theological level. You could do this at a legal level, right, through the fiqh. This is another approach that what you could say is that, that when someone gives charity, our fundamental understanding is that cure comes from Allah subhanahu wa ta'ala, and this is a means by which you're attracting that divine attention. And we know how this relates. We have details of how that happens, and it provides you a window to describe that. That's the thinking behind this. When you talk about visitation by others, the idea that bringing with you and in the presence of angels that somebody gains some contentment, some sukoon, that there may be some elements of healing that come with that. That is a way that we can relate this back to why actually visiting the sick may have a tangible impact on that person, maybe not on their physical healing, but maybe on their psychological state. There are different ways to think about it. And again, that was the intent of trying to do this.